Hello, my name is Kelsey Belt, Application Specialist with NextGen. The purpose of today's recording is to provide you with a short high-level overview of using NextGen Mobile on an iPad. So I'm going to go ahead and type in the 4-digit PIN to enter into the application. Once I'm launched into the application, you see I'm brought to the hub screen, which is more of that administrative side where the provider can view their provider approval queue. Here you see on the left-hand side are all the documents, images, lab results that is funneled to the provider approval queue for their review and sign-off. Once I go ahead and actually select a specific document from this list, it's going to populate in the center for me. Again, just much larger real estate for the provider to go ahead and review that document in its entirety without having to zoom in as you would on that mobile device. Coming back to our hub here, tapping on our tasks, same functionality, same workflow as if they were using NextGen Mobile on their mobile device. Again, just larger real estate. So here they're able to go ahead and access that specific task. Down there at the bottom, they have their action items to go ahead and accept or reject. They also have the ability through here on the top right to create that new task on the fly. Same functionality, same workflow. They want to attach a patient, they could certainly tap on that little blue circle to go ahead and add a patient that they want to go ahead and attach to the specific task. They can certainly type in a subject, who it's to. We'll have their favorites if they are defined in the EHR. Those are honored on NextGen Mobile, whether they're using the mobile device or an iPad. So they could go ahead and select their specific group that they want to go ahead and send this task to. On the bottom, you see that paperclip attached. I can go ahead and attach a document should I want to attach a document for this specific task. And then I can go ahead and tap in the body of the task and go ahead and either type it if they have a keyboard attached to their iPad, or they could utilize their native dictation on the iPad to go ahead and dictate a quick task and get that sent off. Jumping over to our schedule view, what's nice about the iPad is on the left-hand side, the provider always has that complete visibility to their schedule for that day. They can still utilize that calendar that you see at the top right of that schedule view to go ahead and jump to the next day, the following week, what have you. So again, same functionality, but what's nice about the iPad is all I need to do is actually tap on a patient, and then that patient details page is brought to the center of the screen, and I'm still able to have that full visibility of my schedule on the left-hand side. So the provider can really just utilize this screen to see their schedule on the left-hand side and do any sort of chart prep as I navigate through these patients. It's going to change that center portion of the patient details to whatever patient I have selected on the left-hand side. So here I still have access to that, vital pieces of information such as those medications. I can prescribe new medications from here, past medical surgical history, and then of course hopping over to documents and images. That's that categories file. Again, same type of workflow, same type of functionality, just much larger real estate. The provider can do their chart prep, chart review. They can pull up that last chart note, and again, that chart note will populate in front of them with their ability to go ahead and have complete visibility to that without having to zoom in if they were using that on a mobile device. Now, once the provider is ready to go ahead and dictate, they could certainly utilize that orange microphone down at the bottom. The other icons that you're seeing at the bottom are the same workflow that you would see from a mobile perspective. They work the same, image capture, scanning documents. It's the same workflow, same functionalities you would be seeing on mobile. Again, just a bigger screen. So I'm going to go ahead and tap on the orange microphone here, and I'm brought to that dictation screen where you do see those tap templates where the provider can ultimately choose what they're trying to capture for the day. Provider favorite, it's typically the plan that they want to go ahead and capture the most detailed part of that to go ahead and supplement whatever is pulled in from the EHR perspective. So once they go ahead and dictate into that and hit send, it's going to send directly to the EHR. So I'm going to go ahead and do just a quick plan here and get that sent off. Advanced neurovascular age-related macular degeneration, OU, this is ultimately visually limiting, period. Cataracts are present in both eyes, period. I doubt cataract removal will help increase visual acuity, however, I did discuss with the patient, especially in the left, cataract surgery will help visualize the macula for future laser treatment so that his current vision can be maintained, period. Go ahead and hit stop, and in the top right, I can go ahead and hit send. Now once that's sent, that's going to be sent over directly to the EHR to supplement anything that's been pulled in from the EHR perspective, and the provider can certainly tap on that next patient, begin their chart prep, chart review by going through the same workflow, accessing the last chart note, and then of course tapping on that orange microphone to go ahead and begin dictation. This concludes the recording of NextGen Mobile utilizing an iPad.